Originally, I was a PA major, kinesiology, and was going to apply to PA school later on. My mom had a hip surgery, and I got to kind of see that role of a nurse, and I loved that interaction with the families, with the patient, and really getting to be a part of their everyday.
Skylen was really hardworking, set really high goals for herself. She also was a pretty lighthearted young lady, and so she was able to kind of make the people around her better. I knew in high school that she was really looking at SVSU. She wanted to go to play soccer, she went and visited, and I think she just fell in love with the campus and the university, and it just felt like home to her.
Skylen is a very energetic, positive, outgoing individual. Brought tons of energy and life to practice, games, and any team activities that we ever held throughout her time here at SVSU.
Playing for Coach O'Neill was awesome. Soccer at SVSU made the experience more comforting, being away from home, my first time on my own, and I had a team from the beginning, from day one.
Skylen grew a lot throughout her time here. She didn't play her senior year, she was diagnosed with mono. What could have been and was a tough year for her not being a contributor on that field. She brought her energy, she brought her passion, she brought that drive every single day, and that's testament to her and her character.
Skylen was the center of a very good cohort of students who worked very hard together and was looked up to for her knowledge and her tenacity and wanting to learn everything, but she was also very good at teaching it.
Dr. Toth had a huge impact on me in my nursing career. She started off in pediatrics and has done that, and that was what my go-to was from day one of the nursing program.
You can read things in a book, you can talk about it in class, and it makes no sense until you relate it to an actual person. Part of what makes the SVSU nursing experience unique is the simulation part of every single semester.
With simulations, you got to practice checkoffs and different skills, which was huge for going on the floor. If there was one thing that my nursing professors pushed upon me and really had me bring with me into my career, it would be safety for the patients, safety for everyone around, medication, room, everything like that.
When you see the students' light bulbs just go off, that look of when they finally say, you know, I feel like a nurse. Watching Skylen go through that and then loving pediatrics as much as she did when she did that clinical rotation is just the best part of my job.
The most inspiring part of being a pediatric nurse would definitely be the children themselves, knowing that I got to impact their time at the hospital.
I would tell Skylen, just keep working hard, keep being who she is. Doing that has got her to where she is today.
Stick with it. Sometimes it's overwhelming. And have fun. That's the beauty of working in pediatrics.
Keep being you and representing our program with pride.